Food for Thought with Professor David Dete.
Welcome once again to another episode of Food for Thought with Professor Dete. 3 weeks ago, we began a series on the effects of violence in the media on our children. And even some of us adults are being affected by the violence we're being exposed to in the media. Well, this episode, we are wrapping up this conversation. And as always, give us feedback. As I always tell you, if there are any topics you would want us to discuss, let us know on our SMS lines 20316 and WhatsApp 0786 316 316. Let's go back to the conversation where we left it off last week as we wrap it up today.
People are always on the media, in the sitting room. You get addicted to people. I get people who really can't get out of that. We just talk about internet. When they start introducing internet in this country, people start talking about internet addiction.
Yes.
It's because, again, when there is an element of addiction, again, it is a biological phenomenon. Because in the brain, you see, again, in that part of the brain we call the limbic system, where there is something to do with emotions. There are certain chemicals, we call them serotonin. They are the ones that cause pleasure. And if there's something you are addicted to it, it's because your brain produces an excess of this substance, and if it reaches that part of the brain that causes pleasure. You want to do it because it causes the release of those to go to that part of the brain that causes, and you find yourself doing it over and over and over again. And even though your front part of the brain is telling you this is wrong, this is wrong, this is wrong, you keep on doing it. It's like the things I hate to do are the things that I keep on doing.
Yes.
You know that story?
That's scripture.
Yeah.
The things I want to do, I don't do. The things I don't want to do
are the things that I do.
Are the things I keep finding myself doing. Yes.
Yeah. Same principle. Yeah.
Adults. Do adults also get affected by these things we're talking about, or is it just children?
Children are more vulnerable.
Okay.
Yeah. Children are more vulnerable, but when it gets to the level of addiction, then the adults also get affected. You see, the children will not say, as you and adult will say, my head tells me what I'm doing is wrong, but I can't stop doing it. The children don't have this part of the brain well developed enough for them to say, what I'm doing is wrong.
Okay.
Yeah.
Is there help for parents who find their children in that space? What help is available for them? Maybe a child is having nightmares because they keep watching horror movies, or their child has become so fearful because of the things they have watched, like what we were talking about, the Ukraine, or the other time here when we had the terrorist attack or the bomb blast. Because they see things like that now, they're afraid to go outside, they're afraid to do anything. How do you help children like those?
Well, I think when it comes to that level, it's becoming more or less clinical.
Okay.
And what I mean by clinical is it is already beginning to cause problems. Some of these problems are medical, like anxiety and phobia. We have talked about some of these things. They get depressed. And by the way, children get depressed. And I think at that point in time, you can employ different methods of treating. Now it becomes clinical because we are dealing on a one-on-one basis. It's like you are dealing with a patient. Then the principles of management will be basically the same, regardless of what may have caused that. But you also take that opportunity to talk about the cause. You get that opportunity to also involve the parents so that they understand the behavior of the children, so that they can support the children to get out of this kind of situation. So it becomes one-on-one at the very basic level. But at the end of the day, it is not just a problem for the child, it's a family problem.
It's a family problem.
So you involve everybody. And you see, when you involve everybody in the family, the dad, the mother, and the children, you find those people, they can be very, very supportive. I don't know why, or for a long time, the practice has always been to to see everybody as an individual. And you go to a clinic and the doctor wants to, the child is the one with the problem, and the parents want to stay out because that's the way they have been socialized.
Yeah.
Or the doctor wants to say, well, you are not my patient, this is my patient, so I want to. I think we really need to move away from that kind of practice. Because as I said, a child in a family is in an environment.
Yeah.
And if you want to manipulate the environment to suit the child, the child does not have the power to change things. It is the parents, and of course the other children who also care very much for the brother and sister. They will say, well, we don't like what we are doing, or we can do this, or we can do that. The family is very, very, very powerful unit in the healthcare system. And I think even as people begin to do research and the best way to provide services in the most economic way, they will come and tell you, or the people are beginning to, and it's very well documented. They say, listen, this person of yours is suffering from, say, shall we take, say, give a good example, is suicidal. Yeah. And they may commit suicide. I'm just saying that as an example. What is much easier? To tell the parents or the family, this person is suicidal, can do anything. They are likely to take an overdose of the medicine that we give you. So let us admit him to a hospital so that we can supervise the taking of the medication. Okay, admitting the patient to hospital has got lots of other financial implication, the money that they may not have. But what we do in the hospital, we just make sure that we take the medicine, the nurse takes the medicine and gives it to the person. What if you sat them down and said, they can do this? Which one of you is going to play the role of a nurse? Yeah? The father, the mother, the brother. You take this medicine, give it to this boy or to this girl. Don't allow him to have this medicine. Make sure that is properly locked up so that they have no access to it. And they get that kind of support within the family. Everybody feels that they have contributed. And of course, for many people, you save them a lot of financial strains by just taking the family as a therapeutic environment. And as much as it is a therapeutic environment, it can also, if not properly utilized, be the environment that causes the problems. You know, we used to be told by the late Professor Mohanchi when we were medical students in the medical school, that if you see a child, I mean, we just used to laugh at him. They said, what is this man telling us? But if you see a child coming to you in a clinic with a problem, you used to tell us, the problem is not the child. The problem is a scapegoat. You say, what's the man they're talking about? The problem is elsewhere. The problem is within the family. The child is just a symptom bearer of a problem that is occurring somewhere else. When did you go and find out where Go and find out where the problem is. I think some people have natural wisdom. They're able to tell you things, and you only get to realize what they are. And like, for example, there's a guy, James McDougall. I know him when we were a medical student. He used to tell us here at Kenyatta National. And at that time, he was a medical person. He was a physician, by the way. He used to tell us, when you have a patient, and this is very important and is relevant to what we are saying. When you have a patient, listen. Listen with your 2 ears. Let them tell you their story. And if need be, bring in the families and let them tell you the story, what is happening. And you tell us, if you do that, you get the diagnosis perfectly right in 80% of the cases. The remaining bit will be for you to do a laboratory test to confirm. The same principle applies. What
about children who get violent? I've had cases of children who become violent either with their siblings or with their friends, or they even become cruel to animals because of things they have seen in the media.
Yes,
How
the
do you
same
help
thing.
it?
It is like, as I was saying, you are made to believe that is normal.
It's normal, yeah.
But then, having said that, there is also the possibility, and this is why at the end of the day you have to take every individual at their own pace. At the end of the day, there is also a possibility that these children have certain medical problems, purely medical problem, like something you call ADHD. You may have heard of it, where they become aggressive, they become distractible, they disrupt everybody in the family. And if you make that diagnosis, fortunately, it responds so marvelously well to treatment. That's if you make the right diagnosis. And the medicines are there, a little bit expensive, but the medicines are there. And you give it to the child becomes well. The children can also have problems of something very similar to schizophrenic illness. They could be hearing voices, and they are responding to those voices. And you do not know what exactly is happening. So take good history. You find these children maybe are hearing voices or they are paranoid. Give them the medicine, the voices disappear. It could be something you call temporal lobe epilepsy. Yes, temporal lobe epilepsy, which affects certain part of the brain. Actually, you see temporal. Remember, you about me talking about temporal lobe.
Yes.
And when they have this problem, they can present with aggressive behavior, and they are not completely conscious of what they are doing. They don't have fees. They don't have those conversions, but it's just a change in behavior. Again, very common indeed. So you just can't say it's because of learned behavior, although it could be learned behavior. But at the end of the day, you want also to rule out these possibilities.
Yes.
So when you see a child who is aggressive, please, I'm talking to you parents, a stick does not always work.
The stick doesn't always work. I like that.
Yes.
The issue could be deeper than what
the issue could be deeper.
Yeah.
And you can imagine this child in the best of his intentions. And I want you to place yourself in the mind of that child. In the best of the intentions, they are hearing voices which are threatening them. And they may be attributing these voices to the dad or the parent.
Yeah.
And then you use a stick. Yeah. And the child says, this is the end of the world. That I am suffering. There are these people who are tormenting me. They could be demons. They don't know what is happening. And the people who are supposed to love me and protect me are the same people who are siding with my enemies.
Yes.
That's the way they see things. So at the end of the day, they say, even my parents don't care about me. Yeah. We are punishing me for things that I've got nothing to do with. I have no control over it. So they don't like me. So I'm better off dead.
Wow.
But you know what? Suicidality is very common. Yes. People don't realize how common it is. And when I'm talking about suicidality, I'm talking about I want to kill myself. With those thoughts, I'm planning. And there's a lot of attempted suicide that we don't even get to know about.
Very true.
Yes.
Wow.
Yeah.
Professor, our time is up.
No, we have just started.
Our time is up. Our time is up. But thank you.
Yeah.
As always, I've learned a lot. Thank you for what you are teaching us as we have these sessions.
Well, it's my pleasure. Yes. As I've told you many times, if it's going to help somebody somewhere, that's my reward. I want nothing else more than that.
Awesome. Our time is up, my friend. Thank you so much for participating and for being a part of Food for Thought with Professor Ndetey. I hope this series on the effects of violence in the media on our children has made some light bulbs come on for you, parent, because we're exposing our children to a lot of violence through the movies they watch and especially the video games that they are playing. Those things may look like they capture their attention and so you keep thinking they're busy, but it's affecting them mentally. So let's be careful and let's sieve what our children are exposed to. Until next week, when we kick off a brand new topic, thank you for watching. And always give us feedback. And if there are any topics you would want for us to explore, or maybe there are topics we've done before and you want us to give more information about them, please let us know. 20316 SMS line, WhatsApp number 0786 316 316. Have a good day.
Food for Thought with Professor David Bitte.
Thank you for watching. Remember, subscribe to our YouTube channel so that you can get notified whenever we upload new fresh content every day. Stay tuned and enjoy fresh, uplifting content.